We are going to get started in just a few moments, but we have other people joining, so just give us a couple minutes, and we're looking forward to hearing a presentation from Monica Bryant today. Thank you, everyone. We certainly appreciate you joining us today. This is Ivy Ahmed from Zero to the End of Prostate Cancer. We have a few more people that are still getting signed in, and so I am going to start in just a minute. So just give us 1 second. We're having a few technical difficulties, and we will get started in 1 minute. All right, thank you for joining us. Like I said, we are having a few technical difficulties, and it's just in the display of the slides, so bear with us as we get that sorted out, but it's certainly easy for me to get started. Thank you so much for joining our program, Managing Costs of Prostate Cancer Care, brought to you this afternoon by Zero, the End of Prostate Cancer, and our colleagues at Triage Cancer. I'm Ivy Ahmed, the Director of Patient Education here at Zero. Before we get started, I want to go over a few housekeeping items just so that we all know how things are going to go today. Our call is being recorded, and it will be archived on the Zero website at a later date. It will be available by next Monday, hopefully by, if not sooner. And the format of today's program will be as follows. I will introduce you to our organization, and then our presenter, Monica Bryant from Triage Cancer. I'm going to go ahead and give you an overview of what we're covering today, and then I'll hit a couple basics about the incidence of prostate cancer and how many people will be impacted this year, and then I'm going to hand it over to Monica to start our program. Once she finishes her presentation, we're going to start the question and answer session. And for those of you who are participating over the computer, if you want to ask a question, just go ahead and type it into the question box that you see on the webinar user screen. You can submit a question at any point throughout the entire presentation, and we'll be able to take a look at it then. The end of the program, we'll go ahead and I'll help you. I'll share those with Monica, and we will answer them for you. We have an hour today for the presentation, and we'll try to answer as many questions as possible. For those of you, when you close out, for those of you that are online, When you close out, can you please take a few minutes and finish do our survey? It's only 10 short questions. Your feedback is exceptionally helpful to us. It actually helps us decide what programs we're going to do in the next few months and how we're going to change things. It gives us thoughts on other information that we can share with you, not just through webinars and programs, but also on the internet programming. So let's get started. I'm going to tell you a little bit about Zero and us, what we do at Zero, the End of Prostate Cancer. Just so for those of you who are new to our organization, I mean, Zero is our mission, and that really is to end prostate cancer. And so we save lives and stop pain and suffering by advancing research, encouraging action, and providing education and support to men and their families. We do our best to serve the community through a variety of programs and services, and I certainly encourage you to visit our website to learn more about us. Feel free to contact myself or anybody else on our team to learn more about the programs that we're offering. And some of those specifically interesting programs that you might want to know more about are, we have nearly 40 run-walk programs throughout the country this year. So please visit our website to see if you can find a program near you. They are awesome programs. There are lots of fun opportunities to connect with survivors, men who are living with the disease, and a lot of other folks who are very passionate about helping us to realize the end of prostate cancer. We also have government relations and advocacy. We have a research fund. We provide patient copay relief for men with prostate cancer. And we do education and outreach programs such as this. We provide print materials and online materials, and we also have a free testing database. So I'm going to talk to you today. Presenting to us is Monica Bryant. She is a cancer rights attorney, speaker, and author dedicated to improving access to and the availability of quality information on cancer survivorship issues. Ms. Bryant is the co-founder and chief operating officer for Triage Cancer. Throughout her career, Ms. Bryant has provided hundreds of educational seminars, written articles, and blogs, and appeared on television and radio shows discussing cancer-related legal issues like insurance, access, and employment rights. We are very fortunate to have Ms. Bryant with us today to share her expertise and knowledge. And then just to give you an idea of what we're going to cover, our agenda, we'll just talk a little bit about prostate cancer today. And then I'm going to hand it over to Monica, and she'll talk about health insurance options, income options when unable to work, some other financial resources that are available for assistance, and then we'll switch over to our question and answer period. Just to talk a little bit about prostate cancer today, 1 in 7 men will be diagnosed with prostate cancer this year. And as you can see in this particular image, prostate cancer is the most frequently diagnosed in American men. That represents more than 25% of all new prostate cancer cases. The estimate is that 220,800 men will hear those words, "you have prostate cancer" this year. And sadly, more than 27,000 men will die from the disease. We are fortunate, though, because there is hope for men who are diagnosed to live a very long, healthy life with good care, early intervention, and learn from the nearly 3 million prostate cancer survivors in the U.S. today. When being diagnosed with any cancer, and particularly prostate cancer, cost is always a factor in making decisions around treatment and how best to manage the entire course of the disease. And so I am excited to learn about how we can better be informed and make decisions to help move that along. And I'm going to turn it over to Monica to learn more today. Thank you, Monica.
Thanks so much, Ivy. I'm absolutely delighted to be here to talk a little bit about finances and dealing with the cost of care. And so as I get my presentation ready, so forgive me, I wanted to tell you a little bit about Triage Cancer. So Triage Cancer is a national nonprofit organization that provides education and resources to healthcare professionals, survivors, caregivers, and really anyone else who is dealing with this illness. And we do this in a couple of different ways. So we host a speakers bureau. We have online resources that are available to anyone hosting an educational event. And if someone was looking for a speaker, they could fill out a speaker request form on our website, which is triagecancer.org. And so I'm hoping that now you all can see the slides. More information can be found on our website. You can check out our online blog. So there are many factors that can contribute to a feeling of financial instability, and perhaps the most obvious is this high cost of treatment, which often means large medical bills. But we know that having health insurance can make a huge difference in one's financial health. But even those with health insurance may find that their policies don't cover as much as they thought they would. And prior to the Affordable Care Act, when someone was diagnosed, it could be next to impossible to get health insurance. And so we're going to talk a little bit about how the Affordable Care Act has changed that and some new consumer protections that are available to all of us. Now, but having access to better quality health insurance doesn't completely solve all of these financial issues that people might be dealing with. And that's because there are often changes in one's employment status during and after cancer treatment. So perhaps you've had to take time off or leave your job entirely to get through treatment. Or maybe you've moved to part-time. Either way, it's likely that you're feeling that financial change in employment status in your wallet. It can be next to impossible just to pay your monthly bills, let alone keep up with all of these extra medical costs you might be dealing with. And finally, you may have also experienced some life changes in addition to your cancer diagnosis that could be affecting your finances. So maybe you've gotten married or divorced, or you've moved, or you've graduated from school, and all of these things, again, can really have an impact on your financial status. So it's no wonder that so many cancer survivors have questions about finances, and hopefully today we're going to give you some real answers and tips to get you through it all. And unfortunately, this sentiment is very common. And for those of you who are on the phone, this is a cartoon of a man calling his health insurance company saying, I'm sorry, there's an error in my bill because you accidentally sent it to somebody who has no money. And this is, again, a very common sentiment for people who are dealing with cancer treatment. The bills just keep coming, and they can be quite overwhelming. In 2009, a study was done that showed even having health insurance wasn't always enough to manage the cost of cancer care. Because what this study found was that of all the bankruptcies in the United States, 62% of them were due to medical debt. And of those 62% that were due to medical debt, 78% of those people had health insurance. And what that tells us is that oftentimes the insurance that people had wasn't adequate to deal with serious illnesses like cancer. And so that really just kind of sets the stage for our discussion about the Patient Protection and Affordable Care Act, also known as the Affordable Care Act, the ACA, healthcare reform, Obamacare, all different names to talk about one thing. So today I'm going to be referring to it as the ACA. Now, the ACA is a huge law that was signed on March 23rd, 2010. And different provisions were designed to be implemented at different times. So we started seeing changes in 2010, and these changes are going to go all the way through 2020 and probably beyond. We saw some of the biggest changes January 1st of 2014. But please keep in mind that things are still changing on a regular basis, because what's happening is we have the federal government implementing things, we have states implementing things, and as things are being implemented, we're seeing, what's working, what's not working, where there's still some problems. So we're seeing federal agencies put out regulations, and all of that is to say, what I talk about today is how the law stands today, but things may change in the future. And that's why I continue to refer people back to our website and our blog, because we try to keep those up to date with things as they change. Now, for the sake of time, because we only have an hour and we could talk about healthcare reform for days, I'm just going to kind of give you the 50,000-foot view of the ACA. There are some new consumer protections, like ensuring that policies aren't imposing limits on the dollar amount that they pay out for your care. There used to be lifetime and annual limits that health insurance companies would set on policies, and once you hit that amount, you would basically be left uninsured until the policy year renewed. And so the ACA said no more lifetime or annual limits on essential health benefits. And those are really 10 categories of things that most of us expect our health insurance to cover. So ambulatory care, prescription drugs, hospitalization, etc. Also, the ACA said that insurance companies can no longer rescind or cancel your policy once you get sick. And this is happening all over the country at sort of an alarming rate. So basically, unless insurance companies can show that you've lied about something really important on your application, they can't cancel it once you get sick and need to use it. And perhaps most significantly, as of January 1st of 2014, the ACA prohibits insurance companies from discriminating against you based on a pre-existing condition. They also cannot charge you more because you are or have been sick, and that's referred to as premium rating. So the bottom line really is that you should be able to access insurance at the same rate as everybody else in your similar circumstances, and that your insurance policy will be there for you when you need it. Now, there are also some benefits, other additional benefits that are included in the ACA, like making sure that most people will have access to free preventative services. So those preventative services are exempt from deductibles, you won't have to pay a copay, and they're going to be covered at 100%. And if you'd like a detailed list of the preventative services that are included, you can go to healthcare.gov and type in preventative services in the search box, and it will actually give you a list of all of those. Now, I said most insurance companies have to cover these preventative services, and that's because this rule doesn't apply to grandfathered plans. And those are plans that were in existence on or before March 23rd, 2010. So if they were in existence prior to the bill being signed and haven't made substantial changes since, they're going to be considered grandfathered. For practical purposes, the only plans that are still grandfathered are large employer plans. So if you get your insurance through your employer and you aren't sure if your policy is considered grandfathered, I definitely recommend that you talk to your HR person or whoever deals with your health insurance benefits to find out so that you can make sure you're not being billed for services that you shouldn't be. Additionally, there is some standardized information that's required now for insurance companies to give you. And finally, there are some new health insurance options, and that's really what I want to spend the next couple of minutes talking about. So the first option is an expansion of Medicaid. So prior to the Affordable Care Act, in order to be eligible for Medicaid, someone had to have a low income and asset level, and they had to fall into another category. So for instance, they had to be a minor child or have a disability. So that left a large population of people who just had low incomes unable to access health insurance. So what the Affordable Care Act did was create a new category of eligibility for individuals who had incomes at or below 138% of the federal poverty level. So for most individuals, that's going to be an income of less than $16,000 a year. Now, this expansion was supposed to happen nationwide in every single state when the law was written. The Supreme Court got their hands on the law and muddied the waters a little bit and essentially ended up making this expansion voluntary for each state. So states got to decide what they were going to do. So now what we're left with is a hodgepodge of situations that's happening across the country. Generally speaking, we have 29 states who have chosen to expand their Medicaid program. We have 16 states who are not expanding their Medicaid program. And we have 6 states who are still sort of figuring it out. And as you can see, there's lots of footnotes and asterisks here. And this is perhaps the slide that changes most frequently in our presentation because things are changing so rapidly. But I will also say that if you live in one of these states that is not expanding their program and this is important to you, I highly recommend that you contact your elected officials and let them know why this is important to you and why this is important to the cancer community. Because this is an area where we as a community still certainly have quite a bit of power to advocate on behalf of the community. Now, the second option I want to talk about for new health insurance isn't really an option at all, but rather it's a new way for us to shop for and purchase private health insurance plans. And these are the state health insurance marketplaces, sometimes referred to as exchanges. You may have heard that term. And the best way for us to explain these exchanges is they are a shopping mall for health insurance, or Amazon.com for health insurance. So just like in a shopping mall, what you are purchasing are individual private products. So you're going to have the usual suspects of health insurance companies like Humana or Aetna or Blue Cross Blue Shield. And they've now applied to sell their products in this regulated shopping mall. So just like what you would do, let's say you were going to the mall and you bought a sweater from the Gap. You wouldn't then turn around to somebody and say, I bought a mall sweater, but rather you would say, I've purchased a sweater from the Gap. Same thing with these health insurance policies. So this is not government insurance. It is still private insurance, but again, you're just purchasing it through a marketplace that has some very significant benefits. So I first mentioned that insurance companies have to apply to sell in these marketplaces, which means that they have to meet a minimum level of, a minimum standard in order to be able to sell. So there's some quality control involved. Also, there are some financial assistance options available to people who buy in the marketplace. And there's two different types of financial assistance. The first is a premium tax credit, and that's going to be an amount of money that lowers your monthly premium. The second type of financial assistance is called a cost-sharing subsidy, and that's an amount that's going to lower what you pay when you actually access your health care. So it could be lowering your deductible, it could be lowering your copay. So for example, if you have a copayment of $25 every time you go to see the doctor, and that's very common to have a copayment. Let's say you get a cost-sharing subsidy of $10, you would only be responsible for paying $15 every time you go see the doctor. Now, these financial assistance options are based on household size and income level. And so this is kind of how it all shakes out in states that have decided to expand their Medicaid program. So for individuals who have incomes at or below 138% of the federal poverty level, they'll be eligible for Medicaid. For people who have incomes between 138 and 250% of the federal poverty level, they'll be eligible for a cost-sharing subsidy if they buy a silver plan, which we're going to talk about in a moment. Now, if you have an income between 138 and 400% of the federal poverty level, you'll be eligible for a premium tax credit. So as you can see, there may even be instances when people are eligible for both a subsidy and a premium tax credit. Now, I realize that this chart is a lot to take in, but again, it's just supposed to sort of show you that the income levels and the household sizes do matter. Now, here's the situation when states are not expanding their Medicaid program. For people who have incomes between 100% and 250%, they will be eligible for cost-sharing subsidies if they buy a silver plan. So as you can see, the income level is a little bit lower because Medicaid is not being expanded. But when it comes to premium tax credit, it's still for individuals who have incomes between 138 and 400% of the federal poverty level. And the reason that I point this out is because, again, this is a legislative advocacy issue. Because the result of the Supreme Court getting involved means that now people who have, people who have incomes of, let's say, $11,000 will not get a premium tax credit, but someone who has an income of $46,000 will get a premium tax credit. So again, I just wanted to point out that here this is a legislative advocacy issue, and it's an unintended result of the Supreme Court's decision. Now, each state had an option about what to do with their marketplaces. So 14 states decided to run their own marketplace. 27 states decided to let the federal government run their marketplace. And then there's a handful of states who are sort of doing a partnership with the federal government. There are two reasons why it matters what your state is doing. The first reason is, where do you actually start? So if you're living in one of these 14 states that's running a state marketplace, they have their own website and telephone number and sort of process for how to apply for insurance to their marketplaces. If you live in one of the other states, you're going to start at healthcare.gov. So that's the first reason, is where do you start? The second reason is that there is a new Supreme Court case that is pending a decision that may put these financial assistance options at risk. And that's because the way that the law was written said that people would be eligible for subsidies through the exchange established by the state. So a court case was brought basically saying that if people are living in a state that has the federal government running their exchange, they shouldn't be eligible for subsidies. So that's a vast majority of the country that's now in a situation that might not be eligible for financial assistance. So it's all of these states in blue. We don't know yet what the Supreme Court is going to say. We are expecting a decision sometime this summer. And unfortunately, if the Supreme Court rules that this is in fact how the law should be read, the only real solution, there's two solutions. One, Congress goes back and amends the law. And given our current congressional attitude towards the Affordable Care Act, we as advocates don't expect that to happen. And the second solution is for more states to create state marketplaces so that people would be eligible for financial assistance. So again, I just bring that up as a legislative advocacy opportunity, and to point out that we're still, even though this is a 5-year-old law, we're still seeing changes and new things being implemented. Okay, so I mentioned that there's a standardization involved in the marketplace. And one of the things that the marketplace has standardized is cost share. Cost share is the difference between what the health insurance plan or policy is required to pay and what you as the consumer are responsible for paying. And there's four different main levels of plans that you can purchase in the marketplace, and they're based on the precious metals. So a bronze plan is going to be a policy that covers 60% of your healthcare costs once you hit a deductible, and you're responsible for the other 40%. A silver plan covers 70%, a gold 80%, and a platinum is going to cover 90%. Now, generally, bronze plans are going to have the lowest monthly premium, but they're going to have the highest out-of-pocket maximum and deductible. Platinum plans are going to be the most expensive monthly, but they're going to have the lowest deductible and out-of-pocket maximum. So what's fantastic about this standardization for us as consumers is we can take stock of our families and our healthcare needs and make decisions now based on that. So let's say, for example, I'm in the middle of treatment and I know that I see the doctor like every other day. So for me, it's more beneficial to pay upfront a higher monthly premium, but know that 90% of my costs are going to be covered right away, and I'm probably going to have a pretty reasonable out-of-pocket maximum. So then when I go to the marketplace, I can say, just show me all of the platinum plans. And just like if you're on Amazon, it helps you weed out the information that you don't need. So if you're shopping for that blue sweater, you click blue and you don't have to weed through the black and the reds and the orange sweaters too. So in addition to a standardized cost share, plans sold in the marketplaces also have to provide people with a standardized summary of benefits and coverage. So unlike prior to the Affordable Care Act, now all of the information has to be presented to you in a standardized way. So you can look at a plan from Humana and a plan from Blue Cross Blue Shield, and they're going to be presented to you in the exact same way. So now we are able to really compare apples to apples. Also, as I mentioned, all of the plans sold in the marketplace have to cover minimum essential health benefits. So there's a quality control involved here as well. So you might be asking, okay, great, if I'm looking at all of the platinum plans, what are going to be the differences besides cost in these plans? And some of the differences are going to be the networks of doctors and hospitals. So if you have an oncologist or a urologist that you really want to make sure you're still going to be able to see, I would highly recommend that you make sure those doctors are in network before you pick a plan. Another difference is going to be the copayments. So one plan might have a $5 copayment, one plan might have a $50 copayment. And then finally, prescription drug coverage varies widely between these plans. And so two things that are important for you to look at is to make sure any prescription drugs that you're currently taking are covered. And if there's specific prescription drugs that are typical in your course of treatment that you're maybe not taking right now, but that you're probably going to be taking within the next year, I highly recommend you make sure those are covered. And that's one of those areas where it's important to involve your healthcare team in your decisions before you buy a policy. And so far, we've heard very positive results of people being able to talk to their doctors about helping them choose a plan. You know, your doctors probably say, well, I can't tell you what plan to pick, but may be able to point you in the right direction. And then finally, some plans are imposing a separate drug deductible. So you'd have one deductible for all of your other healthcare needs, and then a second deductible for drugs, for prescription drugs. I wouldn't necessarily discount a plan just because it has a separate drug deductible. It's just important to make sure you understand that so that you're not caught off guard when you think you've already met your deductible and you're still being charged for your drugs. So open enrollment is closed for 2015, but there are a couple of exceptions. So Medicaid applications are accepted year-round, and there's a special enrollment period, which I'm going to talk about in a minute. For 2016, we are anticipating that open enrollment will start November 1st and go through January 31st of 2016. But the earliest you're going to be able to start a new policy would be January 1st. So even if you buy a policy on November 1st, you still won't have coverage until January 1st. Now, as we all know, cancer can often create a life-changing event that results in you losing your insurance. So it might be that you now have to stop working because of your treatment or recovery, and so you have a couple of options. Just like prior to the Affordable Care Act, you may have the option to elect COBRA coverage. And COBRA is a federal law that entitles people who work for big enough employers to keep the exact same health insurance policy they had, even though they're no longer working. The downside to COBRA is that it can be very, very expensive because now you're going to be responsible for the entire premium, whereas typically your employer picked up a portion of that premium. And so for a lot of people, COBRA was cost prohibitive and left people uninsured. But there are some benefits to electing COBRA if you're eligible. So let's say, for instance, you're losing your health insurance mid-year, and you've already met your deductible and your out-of-pocket maximum. In that case, it might be more beneficial for you to try to cover that monthly premium for the rest of the year. So COBRA is still a viable option for some people. Also, you might be able to go on to another group health insurance plan. So if you're under the age of 26, maybe you can go on your parents' plan, or maybe you're eligible to go on your spouse's health insurance plan. And then finally, we now have the option, when we lose our health insurance, to ask for a special enrollment period through the Affordable Care Act marketplace. And that's when you're going to have a life-changing event. And it could be that you've left your job, it could be that you've adopted a child, maybe you've gotten married. All of these things trigger this special enrollment period, which gives you 60 days to shop for and purchase a plan in the marketplace. And you would just go to healthcare.gov or your state's marketplace, and there's a link that you can click on to say, I need a special enrollment period. And then before I keep going, I also just want to mention, because I always forget, although I tend to talk a lot about the marketplaces as an online system, lots of people don't feel comfortable putting this information online or would rather speak to a live person. And the good news is that the marketplace has all of those options as well. So there is a toll-free hotline you can call, you can get a paper application and mail and fax it in, or you can actually get in-person assistance. And if you're looking for an in-person assister in your area, I recommend going to healthcare.gov. And on the contact us page, you can type in your zip code, and it will actually pop out all of the trained, certified assisters near you. Okay, so moving on a little bit, because not everything is about health insurance, and even as we learned, having health insurance doesn't solve all of our problems. I want to switch gears a little bit to talk about financial assistance. And again, for those of you who are on the phone and can't see the cartoon, this is a woman talking to a financial advisor saying, all of my money is tied up in futures. Next month's mortgage payment, next week's car payment, tomorrow's groceries. And again, this is a very common sentiment where sometimes it just feels like all that's happening is that bills are coming in and money isn't. And so what do you do when you're in a situation when you can no longer work because of your cancer? That's where disability insurance comes into play. And there's a couple of different types of disability insurance. So there's short-term and long-term. Short-term generally is going to be for disabilities lasting under 6 months. Long-term is going to be for disabilities lasting over 6 months. And you're going to hear me say things like generally and typically a lot when I talk about disability insurance. And that's because every policy is completely different. So this is an area where you have to make sure you understand the policy that you have. So where do people get these policies? There are private disability insurance policies. Some can be purchased through an employer. So for example, AFLAC, I'm sure we've all seen those commercials with the adorable duck doing yoga. That's an example of a disability policy that you can get through an employer. And some can be purchased directly from a company. So MetLife, for example, is one that you can purchase from a company. And these disability insurance policies are designed to give you monthly income to make up for the income you're no longer receiving because you can't work. So generally, you're going to get between 60 and 70% of your monthly salary. And again, it's all going to depend on the policy that you purchased. So a lot of times there's confusion between health insurance and disability insurance. And so the best way for me to keep it straight in my own head is that health insurance is really about paying for just your healthcare costs, whereas disability insurance is for everything else. So your mortgage or rent, your groceries, your gas, etc. Now there are a few number of states that have a state disability insurance policy that you pay into just like you pay into Social Security. And if you end up having a disability, you would get money from the state. So it's not uncommon for people to have both private disability insurance policies and collect from a state disability insurance policy. And then finally, I want to talk about the two federal disability insurance programs. Both of these programs are administered by the Social Security Administration, and they are both long-term disability programs. The first, Social Security Disability Insurance, or SSDI, is tied to your work history. So you have to have worked for a certain amount of time and paid into the system in order to be eligible. And once you've been on SSDI for 2 years, you become eligible for Medicare, which is one of the two federal health insurance policies. Now, the second disability insurance program is Supplemental Security Income, or SSI. And unlike SSDI, this isn't about how much you worked or paying into the system at all, but rather it's about having a low income and asset level. And generally, when someone becomes eligible for Medicaid and isn't able to work, they are also eligible for SSI. Now, because these are disability programs, you have to meet the Social Security Administration's definition of disability. And I often hear in the cancer community people having a hard time with this concept of being disabled or having a disability. And I urge you not to get caught up in the terminology because really it's about using these programs and laws to your benefit. So, again, I just kind of want to make that caveat that here, when we're talking about a disability, it really just means you cannot do your job because of what you're going through. In your case, it might be cancer treatment. And you cannot adjust to a new job. And your disability has, or is expected to, last for a year or longer, or result in death. So again, these are long-term disability programs, and they're really about your inability to work. And it can be tricky because a lot of times people will say, because of my treatment, I can no longer do my job, so I should be eligible for SSDI. But what they forget is just because they might not be able to do their job anymore doesn't mean they can't adjust to a new job. And that's where a lot of times people get caught up with SSDI. So really quickly, with SSDI, you have to have paid into the system 5 of the past 10 years generally. And the amount that you're going to get is going to be based on the amount that you've paid in. So people who have had higher paying jobs in their careers are going to get more money each month. With SSDI, you don't start collecting a check until the 6th full month after becoming disabled. But it can be retroactive for up to 12 months, excluding the waiting period. And the reason for that is that the process of getting approved for SSDI often takes a long time. And so it could be that it takes you a long time to get approved, even though your disability started earlier. And I know that was a complete mouthful, so I'm going to give you a little bit of an example. So here we have a patient who is applying for SSDI on September 1st, 2015, for a disability that began on January 1st of 2015. So they're going to get a check February 2016, right, because it's 6 months after September. And their first month's payment that they're going to get in February is going to include that February payment plus the retroactive benefits from January to August. So I hope that that helps sort that out just a tad. I know it's a little bit confusing. Okay, Now with SSI, as I mentioned, you have to have a low income and asset level, and you have to fall into this another category. So you have to be over 65, blind, or disabled. But unlike SSDI, your payments start immediately, so the first full month after becoming disabled. And so for more information about SSDI or SSI, you can go to the Social Security Administration's website, which is just ssa.gov, and you can apply online and get some more answers to questions if you have them. I also just want to mention that a new program, or a program started in 2008 called the Compassionate Allowances List, or program. And this is a list of certain medical conditions that are presumptively eligible for one of the federal disability programs. And there's about 60 cancer diagnoses on. And this list is changing quite frequently, so I would recommend, if you're interested, looking at the Social Security Administration's website. It's ssa.gov/compassionate allowances. And again, this doesn't mean that you're automatically going to get SSDI, but what it does is it sort of lowers the bar and makes it a little bit easier to qualify. And then finally, I just wanted to mention that a lot of these applications are denied on the first try. So when somebody applies for one of these programs, I highly recommend that they sort of prepare themselves for a denial and keep an eye out for their mailbox for getting that denial, because the first appeal has to be done within 60 days of the denial letter. And sometimes, more often than not rather, you're going to need to work with your healthcare team to file these appeals. So it might be that you need more medical records, or you need them to write a letter. And so if you wait too long to try to start the appeal, you might not get it in time, and then you'll have to start the whole process all over again. There are 4 levels of appeal in most states. The first is this request for reconsideration, which is usually this writing an appeal. And then it goes to an administrative law judge hearing, and then an appeals council, and then finally a federal court review. But statistics show that a vast number of claims are approved just after the first level of appeal. So this is one of those instances when we recommend people not take no for an answer and be prepared to do an appeal. Now, even if you're eligible for SSDI or SSI, it may be that you need some other sources of income. So where can you go for that extra amount of money? There are some supplemental insurance policies that are specific to cancer. So for example, Aflac has a cancer policy. Maybe you can adjust your tax deductions if you're still working, so that less money is taken out each month for taxes. And again, this is a short-term solution, but sometimes that's all people need. There are also some programs with mortgages and credit cards where if you can prove that you have a disability or if you've lost your job, they will suspend payments for a certain amount of time. And the only way for you to know if your mortgage company or credit card will allow you to do this is to ask. And again, this is one of those times where I suggest people not take the first no, because we've heard instances where someone has called their credit card company and asked for a suspended payment program and been told no, hung up, called back, gotten a different agent, and get a different response. So although this is time consuming and takes up what limited energy you might have, it can be really beneficial. We also suggest sort of looking outside the box for some sources of income. So maybe you can use your 401k plan or retirement policy as collateral for a loan. There are companies that now provide loans using your life insurance policy as collateral. And so one that we have worked with in the past is Fifth Seasons Financial. And what's fantastic about them is, unlike selling your life insurance policy, Fifth Season Financial makes sure that there's a little bit of a benefit, or a lot of a benefit depending on your policy, left over for your beneficiaries. So again, you're just sort of using the policy as collateral for a loan. And then there are local, state, county, and community organizations that may provide financial assistance. There are cancer organizations that provide financial assistance, and these are just examples. There's many out there. So the SAM Fund is one we work with that helps young adults. The American Cancer Society and Cancer Care have financial assistance programs. And a lot of times these financial assistance programs will provide money that is not earmarked for your health care. So maybe you do have great health insurance and that's not your problem, but because you can't work, you're not able to pay your gas bill. These programs might be able to help with that. And then I also always have to say that don't underestimate the power of love. So I'm sure that many of you have heard from friends and family, let me know if I can do anything, and you're not quite sure what to say. Perhaps fundraising is a good option. And these are just two sites that, again, we've had very positive feedback from. So Give Forward or GoFundMe. And you can set up the fundraiser. You can have a loved one set up the fundraiser. And this is where people can give any amount of money. So it could be $5, it could be $5,000 to help you. Now, I will just say this caveat, that before you set up one of these fundraising platforms and publicize everything, make sure you really thought through all of the ramifications of disclosing your cancer diagnosis. And since I don't have a ton of time, I will just say that Cancer and Careers has a wonderful blog and information about the pros and cons and things to think about before you disclose your diagnosis and what impact that might have on your employment. And then I also just wanted to talk about some treatment resources. So these are going to be resources that help specifically with your healthcare costs. And there are some copay assistance programs. So remember how earlier I talked about the fact that many health insurance policies impose a copay, and it could be $25, it could be $50, it could be $100. And so it might be really challenging for you to meet that copay either for prescription drugs or to see your doctor. And so in a few minutes, I'm actually going to turn it back over to Ivy to talk about Zero's patient copay program, but here are some other ones that aren't specific to prostate cancer. And then maybe you're having trouble covering your prescription drugs. So you do have a health insurance policy, but its prescription drug plan is terrible. Or you don't have a health insurance policy. How do you cover the costs for your prescription drugs? You have a couple of options. So almost every pharmaceutical company now has a patient assistance program that is designed to help patients cover the costs of taking their prescription drugs. And Needy Meds is a great organization that has a very extensive online database of these different pharmaceutical company programs. And they even have resources to help you apply for these programs. Another company is RX Hope that does something very similar to Needy Meds and helps you sort of go through the process of applying for these patient assistance programs. And I'm actually going to turn it over to Ivy. Oh, sorry.
That's okay. So I do want to talk about our copay assistance program. We have a wonderful program done in partnership with Patient Access Network. We provide copay assistance to men with advanced prostate cancer. To be eligible for the fund, you have to meet certain eligibility criteria, and those relate to income, your specific diagnosis, and also residency. So people need to be, men need to be a resident of the U.S. and receiving their treatment here. They need to be in active treatment, and most importantly, to have received a diagnosis of castrate-resistant prostate cancer. The financial eligibility for this particular program is specifically for men who fall at 500% or below of the federal poverty level. And Monica talked about some of those levels before. It's a very easy program to apply for. You can come to our website or you can call us and we'll connect you through to the, an application portal, and you need to have some information available from through your finances, and then also, your doctor will have to be able to verify some information that what you're being treated with, and that he or she is treating you, and then you usually have a decision within 2 to 3 days. And for us, this is a very rewarding program. We're happy to be able to offer it, and we have served more than 15,000 men, help them pay for their copay assistance and for anti-prostate cancer treatment. So we're very excited about that program, and I'm going to turn it back to Monica to talk a little bit more about Triage Cancer and some of the resources available there.
Thanks, Ivy. So again, I just wanted to mention that at triagecancer.org, we have a plethora of resources, and we're adding new things each day. And one of the things that might be helpful is our blog. And it's just triagecancer.org/blog. And we, again, try to keep sort of up to date with the happenings. We talk a lot about healthcare reform, but we have guest bloggers as well, so please check us out. And shoot us an email if there's a blog topic you'd like to read about that we haven't included. If you could just go to the next slide. We also have quick guides that are all free to download about various laws that might be relevant to you. We have state-specific information, and then we have links to partner publications. Next slide. And then finally, I just wanted to mention a new tool that we are offering, which helps individuals figure out what health care and health insurance options they might have. So you can go to our website and answer 5 basic questions. You don't even have to put in your last name if you don't want to. And it will give you information about your healthcare options down to the county level. So maybe you're eligible for Medicaid, maybe you're eligible for food stamps, maybe you're eligible for Marketplace, but this tool will tell you all of that and provide you with the contact information for the agencies that you may want to apply to. So it's a new tool on our website. You can access it from the home page if you'd like. But please do, if you have questions about what your options might be, please do check it out. Next slide, please. And then this is just how you can find us. Please engage with us on social media. We love it. And again, thank you so much for taking the time to talk a little bit about finances today. And I'm going to let Ivy take it from here.
Thank you so much, Monica. I know I've learned a great deal today, and I really appreciate all of your time. I want to just wrap up a little bit more information about Zero. I know we're coming to the end of our time, but we have received some very thoughtful questions. And so I'm going to just put those out there to remind everybody how to connect with us at Zero. We want to learn more about our educational opportunities, ways to learn about the disease, treatment options, learn from physicians and survivors, and also men who are living with the disease and their loved ones. Visit our website, visit the Learn section if you want to learn how to become an advocate in your community. We have a great mini site that's dedicated specifically to our advocacy efforts. We have a wonderful monthly newsletter that goes out by email every month, and on the second Thursday of the month, you can participate in a run-walk program in your area, become one of our Zero Heroes, or just reach out to us and share your story. We'd love to hear how you're doing with managing the disease. If you want to reach anyone in the education department, you can reach me, Ivy Ahmed, or my colleague, Alice Lee. We are both available by phone or email, so feel free to reach out to us at any time. And then I'm just going to hop over to a few questions that we received during the presentation. So one of those, Monica, was Bob asked, so he's leaving his job and he's going to remain insured. He wants to remain insured, and he has been offered COBRA, but what are the other options for him?
So great question. I think COBRA is a very viable option, as I mentioned earlier, that it can be expensive monthly, but if you've already hit that out-of-pocket maximum for the year, it may be more cost-effective to pay the monthly fee and make sure that you don't pay anything else. But if you haven't and your monthly premium is more than you can handle, I would definitely recommend Marketplace in your state and seeing if you're eligible for financial assistance. Because if you're no longer working, chances are your income will be under 400% of the federal poverty level, and you'll likely be eligible for financial assistance to purchase a plan on the Marketplace. So I would definitely check that out before making your decision about electing COBRA.
Great. And we received another one from Mike, who wants to wanted to know if you could talk a little bit more about the pharmaceutical copay programs that are available versus some of the foundation programs that you had mentioned. Is that for by insurance coverage?
It does. So it's going to be based on insurance coverage, it's going to be based on your income level, and sometimes it's going to be based on your diagnosis. So unfortunately, there's no quick answer to where you should go first, because you might have to do quite a bit of research to figure out what the best program to look at is. But if you are having problems paying for your prescription drugs specifically, I would start at the pharmaceutical company and see if you can get your prescription drugs either free or at a greatly reduced cost. And if you're kind of having a hard time figuring out the program, I would definitely recommend starting at Needy Meds, because not only do they provide contact information, but they can actually help you get through the application process, which, you know, given limited time and energy, that might be really helpful for folks.
Great, and we'll just take one last question, and that is, let's see. As a result of my prostate cancer diagnosis, I'm unable to do my job. So just in talking a little bit more about disability, does that make Steve more eligible, make him eligible for disability or not? So I know you talked about disability, but just a little more about how does that relate if you can't do your specific job?
Yeah, and so this is a really tricky one. When we're talking about the federal disability programs, in order to be eligible, you have to be unable to do your job, and you can't do any other job. And so that can be really hard for people who have extensive training or schooling to do their job. You know, they might say, well, because of my prostate cancer, or the treatment, it's oftentimes the side effects of treatment that leads to people being unable to do their jobs. That can be sort of disheartening to be told, well, can you go do another job? If so, you're ineligible, or ineligible rather. So for example, let's say you've gone through, 15 years of school to be a brain surgeon. Well, now you can't be a brain surgeon, but can you do sales at Macy's? If that's the case, then you have to go do sales at Macy's. You're not going to be eligible for disability. So again, remember the requirements are you cannot do your job, you can't adjust to another job, and your disability is expected to last for a year or longer. And specifically when I'm talking about the federal disability programs, some of the private programs might have a different definition or a different eligibility. So if you have a private disability policy, it's really important to read that policy. And I know it can be as about exciting as watching paint dry, but it can, make or break you financially, understanding that policy.
Great, thank you so much. Wonderful questions that came in from the audience and lots of enthusiasm. Monica, your time has just been so informative. You and Triage Cancer are a wonderful resource and partner to us, and we certainly appreciate you contributing your time and sharing this important information with us.
You're so very welcome. Thanks for inviting us.
Yes, we really appreciate your help and guidance. And just parting words for those of you who are online, a reminder to please take the survey. When you go to log out, it will redirect you to our post-program survey, and if you would just take a few minutes to fill out those questions, and we'll be good to go. Thank you very much. Have a great day, everybody. Bye-bye.